Hello, I'm Dr. Varma, one of the orthopedic surgeons at Manipal Hospital, Bangalore. I'm going to talk about trauma and road traffic accidents, which are immediately connected and of great importance and significance in our day-to-day scenario. We do come across many cases of road traffic accident, and we have a certain responsibility as a referral hospital to deal with secondary and tertiary referrals of these cases. Unfortunately, our infrastructure concerning the road traffic rules and regulations are not optimal. Hence, we are burdened with many cases than what we normally expect. When I say about tertiary referrals, these are the cases referred from other hospitals twice over. Many of these patients miss out on the golden hour by the time they reach to us, especially in cases of polytrauma, where the first hour soon after injury is the most important part, where we may be able to help. This will come in the long way. The fractures we deal with in these situations are mainly of long bones, apart from head injury, chest injury, and cavity injuries like abdomen and pelvis. The prime importance is to be given is the resuscitation, what we call the primary care, where the fluid management, blood transfusion, and early recognition of vital structure damage and immediate resuscitation followed by ICU care. Many a time the patient may be burdened with other problems apart from the injury itself, like domestic, social, and for example, they may be coming from far distances where their approach to a tertiary care hospital may not be that easy. We deal with many of such cases, and in liaison with our MICU team and adult emergency and pediatric emergency team, we resuscitate them, and after the primary care, they go on to the secondary care. That is a definitive treatment, where you need to have the access to the operation theater, where definitive fixation of fractures and stabilization will take place. Once that has been done, patient is brought back to the MICU or PACU, pediatric ICU, and once they are out of immediate danger, they go back to the ward, where we give physical therapy later on and rehabilitation. So the treatment is not complete unless the patient as a whole is stabilized, then rehabilitated to whatever level he or she was prior to the injury. The burden on the society with such injuries are immense if primary treatment is not appropriate. Because if you get a patient who is disabled for life, then you can imagine how much social and domestic problems the family is going to face if initial treatment is not optimal. Hence, we have a protocol at this time that our coordinated approach at accident emergency department, pediatric emergency, in liaison with neurosurgeons, orthopedic surgeons, plastic surgeons, and general surgeons. We all come into play to make a happy ending.